Okay, so we're going to do an examination on your hip.
Mm-hmm.
So first I'm going to ask you a few questions pertaining to your injury. So
Okay.
first, when did you first notice these problems?
A couple weeks ago.
Okay, and have you had any prior history of any hip problems?
No.
Okay. Did you hear anything at the time of onset or feel anything?
No.
Awesome. When do the symptoms typically occur? So like morning, night, after you do something?
After activity.
Okay. Have the symptoms radiated?
No.
Okay. Is there more than one area of pain? And if so, could you point to it?
No.
Okay. Were the symptoms gradual or sudden?
Gradual.
Okay. And what activity were you engaged in when you first noticed an issue?
Cheer.
Okay. And have you taken any medication for this injury?
No.
And then finally, what does it feel like getting out of the car? Is it normal? Does it hurt? Anything like that?
That hurts.
Okay. And so some observations I first saw when you walked in and such. So I was looking at for swelling and bruising. Didn't seem like there was any swelling or bruising, so you're good there. Also didn't see any lumps or masses, which is awesome. Your gait was slightly antalgic. You were kind of avoiding any pain on that hip. Didn't see any difference in hip height, which is good. And I also didn't notice a Trendelenburg sign, which is also good. So I'm going to palpate a few portions of your hip just to test, and you'll let me know if it hurts, if it feels
Okay.
normal. Okay. So first, I'm going to start with your iliac crest. If you want to turn slightly to the side here. So start here with your iliac crest,
Mm-hmm.
up in here. Any pain?
Mm-mm.
Either side?
No.
Okay. Then I'll go down to your aces. Any pain there?
Mm-mm.
Then we'll come back. If you want to turn just slightly this way, we'll find your aces here. Any pain there?
No.
Okay. And we'll move to your sacrum. Any pain there?
Mm-mm.
Okay. Now have you turn back just a tad there. We'll find your greater trochanter. Any pain there?
Mm-mm.
I'll also do the other one. Any pain there?
Mm-mm.
Okay, awesome. So I'm going to have you hop up here onto the bed, and we're going to do some passive range of motion exercises real quick to just test your range of motion. So I'll just have you lay still. You don't like fight back or anything. Don't resist it. We're just going to do this normally. I'm going to bend your knee to a 90-degree angle, and we're going to flex. Any pain?
Mm-mm.
Same thing other side. Any pain? Okay. I'm going to have you flip over, and we'll do extension. Make sure this hip stays down. Any pain?
Mm-mm.
Okay. We'll do the other leg. Any pain?
Mm-mm.
Awesome. All right, now I'll have you hop back down real quick. We'll do our last portion here. Have you do some active range of motion real
Okay.
quick. So with your left leg, we'll start. We'll do abduction. So we'll go out to the right. Any pain?
Mm-mm.
Okay. Do the other leg as well. Any pain?
Mm-mm.
Okay. And then we'll have you go back out again real quick. And then come back down in for adduction. No pain there.
Mm-mm.
Same thing real quick. Back in. No pain?
Mm-mm.
Awesome. Thank you.
You're welcome.